Right, at one point, the food or the drugs or both need to go up. And I would say that I think this linear progression of dose escalation and volume escalation and food escalation can occur for about.
Intelligent cycle design is all about like dose response as opposed to an estimated calculated position of where you want that person to go.
Yeah.
And that I guess is where the beauty comes into it, that you have to understand the pharmacology in order to get that response, and why, you can't just give cookie cutter cycles to anyone, because that response is going to be varied between individuals.
Yeah. And what's bodybuilding, right? Or I'm calling it bodybuilding, but what is this game we play with the drugs? It's your response to food, drugs, and training, right? The better genetics you have, the less training you need, right? Because you just respond better. The less food you technically need, right? Because you're going to utilize that food in a more efficient manner. And probably, in theory, the less drugs you need, but your tolerance for drugs is still probably higher, right? So you see with the pros, they probably grow much better. They like when the pros will say things like, I used 200 milligrams of Primo and 400 milligrams of Deca, and they're huge. Now, while that's probably not the truth, they probably could make progress on a dose like that where you and I would not. Right. But they can also tolerate 6 to 10 grams of gear where the average person would lose their mind on 6 to 10 grams.
Yeah.
So it's both.
From a response perspective, but what I always wonder is how they metabolize the drug. And then Dean already alluded to that. Like individual drug metabolism is very poorly understood. Right. We have the hydroxysteroid dehydrogenase enzymes, glucuronidation, all these pathways, or keto reduction, like you mentioned. So many of these metabolic pathways have never been investigated. And I always wonder, like, is it because the steroids are preserved or being metabolized faster in certain individuals with a higher response and not terrible blood work parameters? Because it could be that they run 5 grams of gear, but they metabolize it super fast. And that's why they don't get adverse effects on their blood work. Or somehow it stays in their body and it doesn't even get to the organs where the blood work parameters would be skewed. So the lipid parameters are not skewed. The lipid parameters are all fine. Kidneys totally fine. It only goes to skeletal muscle due to some sort of magical androgen receptor sensitivity. And then it's metabolized out of there. So I tried to dig into the scientific literature about these topics, could not find anything.
Go ahead.
Yeah,
I was just going to say, to me, it would be more of a density thing than a sensitivity thing. I think the genetic freaks have more density on their muscle tissue with androgen receptors and less probably on their organs, right? So they're not going to get the organ stress. And just metabolism in general, like your mitochondrial health will help you metabolize drugs, right? Like if you've had surgery, you might need more. The three of us probably need more anesthesia than someone who's horribly out of shape.
Right.
And it's one of the things an anesthesiologist checks with before you get surgery is to see what you can tolerate and that's why they're watching you on a monitor during these things. But it would be similar with your steroid tolerance. Even if Dean can run a small amount, it doesn't mean he can't tolerate a higher amount. He just doesn't need it.
Right.
And that comes back to, like, I can show my genetics. I have slow 3A form genetics. So the response is higher in terms of the residency time of the drug stays in the system longer. Whereas I have other genetics for other drugs that are fast metabolized in terms of like antidepressants or Meprazole when I went down through my genetics. And that explains why, like, my mother needs higher amounts of her medication because of that fast clearance of the drug. So, and this is something that no one really checks. They go and do genetic analysis, look at, genetic Genie or Self-Decode, any of these genetic profilers that will show you your drug metabolism in terms of your SNPs or polymorphisms in your CYP genetics. And that'll give you an insight into potentially how you handle certain drugs. But I guess the other thing, even to go back to like the gear, food, training, how long can you sustain like balls to the walls training for before your body just says, I can't take this anymore? And we're talking like true hardcore, like Branch Warren, all out train intensity. I give the average person maybe about 8 weeks. And then from there, you've two choices. And this is sort of where the increasing the dose comes in, and that you either back off and look at your recovery modality surrounding your nutrition, your sleep and everything else, or you just plow more drugs in to help with that increased recovery.
So we're assuming
Which-
we're putting some sort of deload in the picture, like you take some time off from the training intensity at least once a week, every 8 weeks or so. 'Cause, I mean, that's what I do. I train balls to the wall, and then I schedule my 50% deload or full week off from the gym monthly or every 6 weeks, because otherwise I'll tear myself apart. So assuming that that's in place, right, at one point the food or the drugs or both need to go up. And I would say that I think this linear progression of dose escalation and volume escalation and food escalation can occur for about 9 months in total. And then in most individuals, you see that the body weight is too high to the point of them being uncomfortable. The blood work parameters are shit because the drug intake is so high. And the micro injuries have started to occur to the point they really need time off. And this is why I always scheduled, or at least with my clients and myself as well, 3 months out of the year where you basically do the same as the Mr. Olympia competitors. You take off of everything, the food, the drugs, and the training. And you come back down to baseline. And whether that's enough for the stem cells to come back, right? But Dr. Dean introduced this concept. Or if it's enough time to resolve the micro-injuries, which is usually the case, or resolve intestinal problems like IBS or food allergies or just acid reflux that's terrible. I think this 9-month to 3-month rule is pretty straightforward for most competitors. Maybe during this time of the 3-month back-off period, you also diet a little bit to get your insulin sensitivity back. If you had a 9-month growth spurt, for off-season eating. And that seems to be quite sustainable. But the problem is in those 3 months, you can lose quite a significant amount of your progress, which comes back, right, due to the epigenetic response. But that seems to work quite well for people. And it even might mean that you end up at the same dose at the end of the 9-month blasting phase. So you end up at 2 grams, 2 grams, 2 grams for 3 years straight. But every year you're bigger because the sensitivity is somehow returned. Because I think your body just gets tired of processing all the metabolic waste products and the food and the training intensity. And it just gets basically bored, for a better lack of the word.
I leave my training intensity the same all the time. That might not be the common thing. So I don't ever take a deload. But if I go on vacation or something, I might not lift for a week, but I don't ever do planned deloads because some of that probably comes with age too. Now that I'm nearing 50, I just don't train like that anymore. I train a lot less, but I also don't need to take time off because I'm not escalating anything.
Right.
That makes sense. So I guess it could be done either way. For
So you don't-
younger, like guys who are really pushing themselves, I guess it makes sense. You're going to wear things down.
Right. So you don't really follow progressive overload, but it's more like just the maintenance, more pump work. And
I train to failure. My training is probably a lot more simple than most people would think. I train 3 days a week generally. I do cardio on the opposite days. I do push-pull legs. I hit things once a week generally, Monday, Wednesday, Friday. I do 2 or 3 warm-up sets and like 1 working set taken to failure. Failure I define is when I can't complete a task properly, right? Like if I can't get a leg extension up, that's failure. It's not some forced, ugly, contorted, painful thing. That's now you've changed like the leverage. So that's a whole different thing.